just going to take a minute and try and get the closed captioning on, because I know how important that is for some of our attendees. So if everyone could just give me 1 minute here to do that. Okay, they should be on there now. Great. Okay, yes, thank you, Ivy. I just turned the captions on, so if anyone has issues with them, please give Bruno a message. My name is Dr. Mahal. I have worked for a long time with Dr. Arsenault and now Dr. McKay over at the Complex Chronic Disease Program. I am really pleased to be here today about a topic that I think is not talked about enough, and I think really deserves a lot more just attention for our chronic pain, chronic fatigue community. Is everyone able to see the slides okay?
Yes, we can see the slides.
Okay, great. All right. And I already got some feedback about pacing. Okay. Nice slow place, no problem. We'll make sure we do that. So I work at the Complex Chronic Disease and Change Pain Clinic. I may have actually been the physician or met some of you before. I don't have any financial disclosure, so I don't have any relationships with industry. I sometimes do provide some input to CBC about some breaking health information, and everything I share here today is evidence-based or based on high-level expert opinion and quite consistent with the way both Dr. McKay, myself, and Dr. Arsenault practice. And I think Dr. Alex Perelwinkler, who's joining here as well, practices the same. And I see, oh, it's in presenter view. Oh dear. Okay, let's just change that here.
Is that better, everyone? You're not seeing the presenter view anymore?
It's a slideshow view now.
Great. Okay. Always glitches a few times. So, and the reason I share that is probably going into the fact that there is a lot of commercial industry involvement when it comes to diet and nutrition. And so it's a very big business. And I think it's important that we hear information about nutrition and intake of food comes from a non-biased perspective. So that's what I'm hoping I can offer you here. And I hope that what I offer you here is an adjunct to all of the work that you do with Dr. Arsenault and Dr. McKay, and sort of the biopsychosocial approach that we take to COVID, fatigue, and epidemiology.
Dr. Mahal, I think people are complaining about the volume. I don't know why.
Oh, goodness. Okay. How is that, Bruno?
I can hear you very clearly. It's just...
And I'm just going to wait till that feedback comes in through the audience. How is it going? Very distant. Right, I'll just give you a minute.
Okay, how is that?
Sorry, it's much better.
Much better. Okay. 5 minutes in, hopefully no more tech issues. Okay, wonderful. So our objectives today are to recognize how the foods that we eat and the nutritional composition for them can actually influence your chronic pain. I also should have added chronic fatigue experience as well. I really want to focus on the literature that supports the connection, because there is so much noise about the foods we should and shouldn't eat that I really want to hone in on what the data shows us. And then I'm going to help give you some strategies to help modify your diet so you can optimize your pain, reduce the frequency of your crashes, maybe have a little bit more energy in your energy envelope. And with that comes with understanding what foods we want to avoid, what foods we want to increase, and then most importantly, feel you are empowered to make the best choices for your body. Because I think when it comes to chronic illnesses, more than ever, chronic pain and chronic fatigue have such a significant biopsychosocial component to it that you really want to feel comfortable with your management plan. And one of the things I tell my patients is that I could recommend all the interventional pain procedures and medications for chronic fatigue and fibromyalgia, but if you're not comfortable with the management plan, we're not going to get the best possible results. So I really want to give that empowerment to our patients and everybody who's listening here today. Oh, and Shawani said, are you a dietitian or a GP? Shawani, I am a family physician. I have a fellowship in integrative medicine, and I primarily focus on chronic pain and fatigue. So for those of you who are joining a little bit late, that was shared just right at the beginning of the presentation there. So things that I will absolutely share today are foods to avoid, and I'll give away the end right at the beginning is definitely avoiding those ultra processed foods. I'll share with you the foods that you should eat more of, and then I'm going to focus as well on what the science tells us about how the foods that we eat influences our pain and our mental health. And the things I absolutely won't be sharing today is I won't be sharing a new fad diet or something that maybe has been tried in one setting, and of course, anything unproven. So as I mentioned a little bit about my own background, I'm an interventional pain physician. I work at Change Pain. I also work at the Complex Chronic Disease Program. And I think it's important to also recognize that both of the clinic settings I work in are reflective of how I think chronic pain, chronic fatigue, and long COVID should be managed, and that's multidisciplinary, full body approach. So physios, dietitians, social work, somatic therapy, and acupuncture. So are pain and nutrition linked? I'm sure many of you have already come to this recognition yourself. Yes, they're absolutely connected. There is a link between the foods we consume, the way we experience pain, and our overall health status. So there are a plethora of diets that have come out that claim to improve health and well-being. And as I mentioned, there is a multi-billion-dollar diet culture that will tell you what you should and shouldn't eat. And a lot of that is focused on profit and marketing. And so how do we figure out what's really good marketing and what is supported by science and literature? And I think the other part that's really important to tie in here is that we have also created a diet culture. So diet is often correlated with weight and weight loss. And what I want to emphasize is that through this entire talk, I never want to correlate the number on the scale with your health and well-being. So those are two very separate concepts. So when I talk about diet, I simply mean a pattern of eating that supports our health and well-being, and that is not related to the number that you see on the scale. And I think there's, if anybody wants to talk further about that at the end of the presentation and why I think that, I'm happy to do that, but I really want to break out that weight stigma that can exist. So Dr. Oz, Goop, all of these blogs online that tell you what people do and don't eat in a day, what they avoid, celebrities, what part of it is true and what part of it is harmful. And the one thing I can say in certainty is that if anyone tells you there's a magic solution to improving your arthritis or your long COVID symptoms, it's probably too good to be true. And so if you can leave this presentation with one understanding, it's that all of these marketing fads are not meant to focus on health and wellness. They are to sell a product. And so when it comes to nutrition and chronic pain, there are also a lot of barriers to optimizing your nutritional intake. And so we're going to recognize some of those and then try and figure out how to come around them. So patients who have persistent pain have actually difficulty making the nutritional choices that they know they should be making. So it is harder for you to pick what you eat and what you drink. Many of my patients tell me that grocery shopping is either going to lead to energy crashes or they have to leave their grocery cart in the middle of the aisle and go home. Meal prepping and cooking is difficult. It's hard to feed yourself. Then you get the brain fog, what negatively impacts the executive function to actually plan your meals. So how do we work around that? And I think we have some wonderful occupational therapists, although limited in number, that can help you sort of count your spoons and figure out how to do this. But I'm going to give you a few tools at the end of the presentation that you can use on your own to take some of that thinking and executive function out of it. Some of the things I hear and what you probably feel is that you're too tired to cook. It hurts to cut vegetables. You eat something and you have a million intolerances. Perhaps you overeat because it distracts you from the pain and the fatigue. And I've also heard from patients they have too much brain fog to even think about meal planning. And so all of these are really important barriers to trying to figure out what you should and what shouldn't eat. And I'm just seeing a couple comments about folks wanting to take notes as I talk. I promise I will send out the slides with all of my notes at the end, so you don't have to feel like you have to catch every word that I say. So when it comes to chronic pain, it is a perpetual cycle. And so you've probably heard from Dr. Arsenault that where there's stress, there's poor quality sleep. Poor quality sleep increases the amount of fatigue we experience, which makes us less inclined to exercise, which then makes us even more exhausted to focus on our diet. So all of these are independent risk factors that are tied in together. And so you want to start peeling back the layers of the onion and working on one piece, as you can see. So for instance, stress is going to lead to improvements in all of these other risk factors. So if we can manage our anxiety, we can work on our sleep hygiene, we can focus on pacing, we can focus on movement therapy, and we can focus on dietary changes, we can start to actually modulate and change the experience of pain that happens in our body and in our brain. And so starting from right at the very beginning, when we talk about nutrition, food consists of macronutrients and micronutrients. And so I'm going to just very superficially talk about what food is. So when we have macronutrients, we're talking about the building blocks: proteins, fats, carbohydrates. And what's really important is that in our North American culture, we have a plethora of saturated fats in our Western diet. And so it's really important that we figure out what kind of fats we're consuming and which ones we want to avoid. And then we have the micronutrients, and these are just as important as our macronutrients. So when you talk about micronutrients, it's often a reflection of, say, the supplements that we're taking, so vitamins and minerals. And when we look at a balanced, healthy diet, it's the macronutrients and the micronutrients that are coming together to give the body the metabolic requirements that it needs. And so if we have a diet that's consistent with adequate amounts of macro and micronutrients, we have a high diet quality. And so again, it's not about the keto diet or the Weight Watchers diet. We're really talking about the composition of the foods that we are consuming. And is the pace a little bit better? I'm really trying to slow down a little bit. Yes, okay, great, okay. So when we have chronic pain and pain flares, we tend to find in our literature, and it also from what patients tell us, is that they eat less overall, or they may be eating more as a way to compensate for the negative experience they have in their body, but their diet quality goes down. And so patients with chronic pain, and that includes fibromyalgia, central sensitivity syndromes, chronic fatigue syndrome, are at risk for multiple types of malnutrition. And that's really a reflection of why gold standard management of these conditions almost always should include a dietitian, is that this malnutrition piece can become quite a concern. So the less that you move, the more muscle wasting that you have. So the phrase, if you don't use it, you lose it, is very prevalent here. When your diet quality goes down and you don't have enough protein intake, you're actually not going to have the building blocks to create muscle. So muscle is made up of protein. The less that you move and the more time that you have to take to recover from those crashes, the more there is weight gain. And it's really important to note that the weight gain is not because of something patients are doing or asking for. It is simply a consequence of their diagnosis. And I think because these diagnoses tend to be invisible, people often question whether they have a true illness or diagnosis. You, in fact, do. And one of the consequences of them is weight gain. And I really want to try and remove the stigma that often comes along with the weight gain in chronic illnesses. And so if you have a combination of weight gain and muscle loss, you can see how your body composition will change and you become at a higher risk of malnutrition. And so I really like this diagram. When there's pain, and again, you can add fatigue to that as well. I'm going to use the term interchangeably here just for simplicity, and you combine malnutrition. You move less, you gain weight, you lose the muscle mass, and your body loses that push to go and to have the energy to do simple activities of daily living, like cooking. And so all of this is a circle that can be very difficult to break. But we can break through it, and we're going to give you just a few tools to take home to do that. Some of the data, I did promise data, is if you look at our Australian data, 70% of patients who attend a chronic pain clinic had higher than normal adipose, I apologize for the misspelling there, adipose or fat content. And again, we're simply looking at fat from a body composition perspective. You can have an absolutely normal BMI or body weight, but have more adipose tissue than muscle. And that's where the concern is, that when the adipose content gets higher than the muscle content. And those patients are twice as likely to experience chronic pain. So again, it's not the number on the scale, it's about the body content. And so high levels of adipose tissue, which is what happens when you lose that muscle bulk, is a risk factor for developing pain and actually perpetuating chronic pain once it's developed. So the other component that comes with chronic pain and chronic fatigue, I do the medication side of management at the Complex Chronic Disease Program. And so I start and stop a lot of medications, and almost every single medication that I start, I tell patients side effects include GI upset, dizziness, constipation, nausea, and dry mouth. And that comes out so quickly is because I say it approximately 12 times per day. But when you have GI upset and constipation and nausea and a dry mouth, your ability to eat, your desire to eat, and the types of foods that you eat is going to change. And so certainly polypharmacy and multiple medications really does impact your nutritional status. And it can actually also change your gut microbiome. So similarly to the way that antibiotics can change our good bacteria, and we have an increase in the bacteria that we don't want, we can get the same thing with chronic medication use. And I'm not saying that chronic medication use should be stopped, because certainly for some folks, if you're on low dose naltrexone and it reduces the frequency of your crashes, that is well worth it. But also recognizing that those medications are going to change your gut microbiome, and we want to do some things to try and offset that change. And as you change your gut microbiome, your body's ability to absorb nutrients and minerals and process those macronutrients changes, of course. I want to go in on a little bit on pain and sleep. So Most people with chronic pain and chronic fatigue, and in fact with chronic fatigue, a disruption in the quality of your sleep is part of the diagnostic criteria, have poor quality sleep, they have difficulty with sleep initiation, and then they have difficulty maintaining sleep. And actually, the worse our sleep, the more disruption we have in the hormone axis that regulates our appetite. And so I'm going to get a little bit technical, and this is some of our newer research that has come out. Some of you may wonder why you feel like you crave, a deep fried chicken or fast food after a really poor night of sleep. And it's because leptin is a hormone that sends signals to our brain that we are full. And the more poor quality sleep we have, the lower our levels of leptin and the lower the hormonal function of leptin in our body. And therefore our appetite and our cravings actually change in response to this leptin hormone. And just as an aside, when we look at our sort of the paradigm shifts in our obesity research, this hormone leptin is actually something that we're targeting quite significantly, because we appreciate that obesity isn't just about calories in and calories out. It's actually about the hormonal imbalances that have developed. And so this is a really key protein that some of our research is looking at. Sorry, key hormone our research is looking at. And there is certainly a connection here with chronic fatigue and fibromyalgia. And then, of course, as our sleep changes, it changes our glucose tolerance, it changes our insulin levels, and it actually puts you at higher risk for type 2 diabetes. So you can see how all of these things are certainly connected. And so the way that I recommend combating this sort of surge in appetite or the cravings that can exist with really poor quality sleep is by recommending just regularly timed meals, if that's an option. So you have your breakfast at 9, you have your lunch at 1, and then you have your dinner at 6, and then you have your 2 snacks in between, or however many it is that you feel like you need, and you time your intake. So you can sort of offset the role those hormonal changes have in your appetite. And then I really recommend not consuming caffeine after 2 p.m. Some of our most robust data says to not have caffeine after noon. For a lot of the chronic fatigue syndrome patients, they need that caffeine to try and get them through to the end of the day. And so I shifted by a couple hours, and I say have that last cup of coffee at 2 p.m. But certainly caffeine has a 12-hour half-life. So anything that you consume at 10 a.m. is going to be circulating in your body at 10 p.m. as well. So just be mindful of that. And then there was a wonderful study that came out of the Journal of Human Nutrition, and they looked at the impact of dietary interventions of patients who have chronic pain. And they found that they looked at 71 different studies, and their goal was to look at how does pain severity change when you modify an individual's diet. And the population they looked at was just adults with chronic pain. And what they found, actually, so I'm just going to give a quick screenshot of the study here, because I promised to focus on the evidence and proof that I'm focusing on the evidence, but I'll switch over to the results, is that 58% of patients had higher than normal adipose tissue. And again, I just want to focus on the adipose tissue component. And of those 58% of patients, almost all of them had fibromyalgia, osteoarthritis, or rheumatoid arthritis. And so they have found a very, very specific correlation between nutrient intake, our adipose tissue content, and chronic pain conditions. And what they also found was that if you can alter someone's diet and you can alter the nutrients they take, we can make a significant reduction in the pain that they experience. So I really want to go through this table effectively. Okay, and I just see a lot of comments here. So I'm just going to pause for a minute and make sure I'm not deviating too much from what you guys want to hear about. Okay. Okay, I'm on the right track here. Okay, good. I will get to all of the questions at the end. So Patients who switched over to a vegan diet, a vegetarian diet, or a Mediterranean diet had the greatest reduction in their pain. Patients who simply had a change in the macronutrient content of their food, such as fat, fiber, or protein composition, had a smaller number of patients with a reduction in their pain, but certainly that signal was there. We saw an excellent response in patients who took omega-3 fatty acid, as well as multivitamins. And I know this question is going to come up because I get it all the time. What about intermittent fasting? Intermittent fasting, there were 4 studies that looked at this, and only one of them found a significant reduction in pain. And so there is some data on just the specific weight loss component, but we don't have that data for the chronic pain experience. But certainly we have a lot of data on the quality of the diet that we have, the type of nutrients that we want to optimize, and the type of supplements that we want to be taking. And I know so many patients have spent hundreds, if not thousands of dollars on supplements and nutraceuticals. And Dr. His name is escaping me. Dr. Morello at the Complex Chronic Disease Program, who's a naturopath, he tells me that the first thing he tells his patients is to put all of the supplements away. He said, take the whole list, take the whole cupboard, and throw it out and start from scratch. And really, and that's not to dissuade those of you who maybe have a series of supplements that do really well on them. It's just that there's such little data on so many of the supplements, but we do have data on very specific ones, and that's the omega-3 fatty acids and our multivitamin. And so if you're looking for any place to start or cut down on costs, just ensuring you're getting these 2 vitamins is a great place to start. Okay. So when we look at our systematic reviews, which are our highest quality of evidence, and there's a pyramid of evidence, and our systematic reviews are right there at the top. So those are our gold standards of looking at a set of data and saying, yes, this is good quality research. We can back this up. Our systematic reviews tell us that, first of all, a lot of the studies we do aren't of great quality. But they're also telling us that our knowledge of nutrition has changed a lot, even in the last decade. So if you looked at pain clinics 20 years ago, we weren't looking at optimizing your diet, your gut microbiome, your supplements, optimizing your body composition, and getting you moving. This is really a paradigm shift in how we're treating chronic pain. And the fact that we've actually moved to having chronic fatigue syndrome clinics is a paradigm shift, but also on top of that, having a dietitian who understands the role our nutrient intake has on our pain and fatigue experiences is paradigm shifting. Now, I will say a lot of our studies don't look at long-term pain scores. So I can't tell you in 15 or 20 years that the dietary recommendations I'm telling you to have today are going to impact you in 1 or 2 decades. But what I can tell you is in the short to medium term, so 1 to 5 years, we are seeing good impact. So I want to make that caveat. And I will also say we're always looking for more high quality studies in chronic pain populations. But what I'm sharing with you today is the best that we have. And I have about 5 years worth of sort of pain score and impact that I can share with you. So I'm sure you're just all waiting for the kicker. So what should I eat? What do I do? How do I sign up for this optimal dietary pattern? And I'm really going to go back to the basics. And it's so basic that I sometimes tell patients, well, Dr. Mahal, I already know that. Give me something new. And I say, well, there isn't anything new. I really want you to optimize the information that we have. And so we want to reduce our pro-inflammatory mediators that result in oxidative damage. We want to improve our diet quality. So you're meeting your own micronutrients, and that may involve you working with a dietitian or a nutritionist to understand what your specific needs are. You really want to focus on high quality, non-saturated fat intake and promote the intake of omega-3 fatty acids. So I want to emphasize here that for a long time, particularly in Western culture, we've thought that fats are bad. Fats are not bad. They are a basic building block. They are a macronutrient. It's just the type of fats that we consume, the saturated and trans fats. are bad. And I rarely use the term bad, but they truly are detrimental to our health. And then you want to support your gut function. So if you're doing all of these things to optimize your nutrition, how do you make sure your gut is able to absorb them? You support it with fiber intake, so 30 grams per day, and 2 liters of water at a minimum, if not more, if you have the coexisting dysautonomia and the POTS. And I'll just remind everyone, you don't have to write this down. I will send this out to you. And then finally, again, I want to emphasize this is not about the number on the scale. It's about optimizing your lean body mass. And so that really means increasing the muscle content in your body, decreasing the adipose tissue. To do that, we recommend optimizing your protein intake. So we're looking at about 1 gram per day. Sorry, it should say, that was supposed to be a weight-based recommendation. I will send that out in the slides. So your protein intake should be reflective of on a per gram per kilogram basis, and it varies a little bit between males and females. You want to make sure that the saturated contents that you do have are less than 7% of all of the fats that you consume. And so what that means is if you're buying something from a grocery store and it comes with a nutritional label, look at the back, look specifically for saturated and trans fats. And if you see that number start to get higher than all of the rest of the other fats, you want to put that back down. And it can be really misleading because if you go to Whole Foods, sometimes something that looks organic or no GMOs or grass-fed. So they have these really great buzzwords that sell. But then if you look at the back of the package and you read the label and I shouldn't say Whole Foods because they're better than the other, but I'll say Superstore. And you look at what is in the packaging of that food, I usually say the less words you can recognize, the more inclined I am to tell you to put it back. And the higher those saturated and trans fats are, the less I want my patients to take that product and put it in their grocery cart. And that's a really simplified way of saying it. But not all carbohydrates are the same and not all fats are the same. And so if something has 150 calories, but most of it is saturated in trans fats versus a different product that is 150 calories and is full of omega-3 fatty acids and whole grains, I'd much rather you have those sort of whole food, non-processed type of foods. And so you want to increase your overall healthy fat intake and you want to have those high quality carbohydrates. So really the best pattern of eating that we have is the Mediterranean diet. And if I can just pop into the Q&A, can I just get maybe some hand raising for those of you who have either heard of it or tried it? Yeah, so lots of thumbs up. Okay, great, fantastic. Okay. Sometimes the literature refers to this as the anti-inflammatory diet. I one day had a discussion with our dietitian, and we really compared the two side by side. They're essentially the same. The anti-inflammatory diet and the Mediterranean diet are the same. So if you're going to pop it into Google, the recommendations are going to be the same. And what we really like about this in the scientific community is there is a focus on anti-inflammatory foods. So you're not just getting foods that aren't processed. The foods that you're eating in the Mediterranean diet are also good quality caloric intake and good quality nutritional intake. So these are nutrient dense foods. Now, if you go back to when I talked about when you have chronic pain, your muscle mass decreases with poor protein intake. What we really want to do is we want to optimize that macronutrient content and have nutrient-rich foods. And that's where the Mediterranean diet or this anti-inflammatory diet is really powerful. So things that I want folks to sort of stay away from. So we're going to do the don'ts at the beginning. Are the refined carbohydrates. So white breads, white pastries, white rice even. Rice with molasses in it, French fries, anything that's fried or in like onion rings, deep fried shrimp, soda, fruit juices, sugar sweetened beverages. And I can say I'm actually old enough that I grew up with a Canada Food Guide saying fruit juices were a very acceptable substitute for fruits. And they were referring to fruits that came from a carton. That is absolutely not true. We actually know that fruit juices are not a replacement for apples, bananas, grapes, strawberries. Those are all very processed and they're filled with artificial sweeteners. So we want to stay away from those. So fruit juices are not a substitute. There is a lot of really good data that tells us that red meats are very high in inflammatory mediators. So burgers, steaks, processed meats, deli meats in particular. They are actually a class 1 carcinogen if you look through the World Health Organization, meaning if you have red meat 2 to 3 times a week on a regular basis, your risk of colon cancer and several other cancers goes up. And again, we think that's because of the pro-inflammatory response it creates. And so for a lot of people who grew up eating the steaks and potatoes and it's such an ingrained part of your diet, this is probably the hardest one that I have patients and I have to convince patients to maybe deviate away from. Again, it's a big part of our Western diet, but we can change the animal protein that we intake and still have that nice taste with seasonings and other things. But it really, if you can take out the red meat, you're doing yourself a big favor. Margarine, shortening, lard. So all of these are examples of these ultra processed foods. And I've actually seen the term ultra-processed foods come out quite a bit more over the last year or so. There was actually a recent Globe and Mail article. Their dietitian published a piece on the dangers of ultra-processed foods. And I really try and stay away from these dramatic type of words like dangers and bad foods. But I'm going to be dramatic here and say, please stay away from ultra-processed foods if you're able to. So ultra-processed foods, what are they? So foods that are highly processed or ultra-processed have a lot of things added to them. So on the contrary, unprocessed or minimally processed foods are just whole foods where the vitamins and nutrients are intact and the food is in its natural state. So chicken, apples, carrots, strawberries, unsalted nuts and seeds, whole foods. Then you have some processing that can happen, for instance, in canned tuna. You've added salt and oil and sugar, and so that changes the composition. And those foods, fine to eat. But the foods that are highly processed or ultra processed means you have things like artificial colors and preservatives. They're made of substances that are extracted from foods like fats, starches, sugars, hydrogenated fats. You also have stabilizers that are added. And so I'm sure you can all inference what type of foods this is a reference to. It's the fast foods, the frozen meals, the cold cuts, the packaged snacks, the salty snacks. And I often get questions from people who say, it doesn't matter what I eat. It's like I have a full body inflammatory response. And from speaking to my colleagues, we think a lot of that allergic reaction or intolerances to food or the gut dysfunction comes from the fact that so much of our food is ultra processed. And that maybe switching to less processed foods while still getting, 3 meals a day can sometimes be quite helpful for patients. It doesn't work for everybody. Some of you have a lot more gut intolerances and microbiome dysfunction than simply switching out your foods. But this is definitely one place I would start. And I think an explanation that makes sense in my head is that inflammation is our body's response to a threat. So when you have a virus or a bacteria, your body mounts an immune response to try and fight that off. They say, I don't know what this is. This looks dangerous. Let's create a pro-inflammatory response. And then you start to get the flu and all those sort of things. I think that when we have so many of these ultra-processed foods and additives that our body can't break down, we don't have the enzymes for, and that our body sees essentially as a virus or a threat, we mount an inflammatory response to it. So our immune system reacts to it. And I think that's why so many folks, particularly as they move into their 20s and 30s, they start to get these gut intolerances because they're having an immune response to the artificial additives that are added. So that's my opinion. That's also an opinion I know some of my colleagues share as well. I don't have any robust data to say that's the case. So this is where I'll say that this is sort of that expert opinion that's coming in. But that's our take on ultra-processed foods and why they're so difficult to tolerate. I think the most concerning part, and Again, I apologize for that spelling error. It should say United States. 58% of the calories eaten in the United States, and this was found by the British Medical Journal, are ultra-processed foods. They aren't even this category where they're mildly processed or moderately processed. They are ultra-processed. And so just to give you an idea of where that change happens, so if you have an apple and then it gets processed to apple juice, and now you have an apple pie, or you have a carrot that's gone from carrot juice to carrot cake, that's where that processing happens. And so it's not necessarily about the caloric intake, but it's about the nutrient quality, but as well as all the other additives that are coming into these ultra-processed foods. And then so what is the connection between pain, and then another step from that, chronic fatigue syndrome and the fatigue and the crashes? Again, we think it's because it creates a persistent low-grade inflammation. That inflammation then alters your gut. We also know there's a gut-brain connection, which influences our mental health and our serotonin and dopamine levels. And then it can promote or aggravate chronic diseases that are already there. And so that includes chronic pain and chronic fatigue. And so for those of you who are on low-dose naltrexone, you've probably heard that naltrexone modulates the immune response in the body, so down-regulates all of those inflammatory mediators. You can sort of do the same thing by modifying your diet. And that's why I think nutrition is so important in these conditions, is that we can change the amount of low-grade inflammation by changing what we put into our body. And if we can stay away from the ultra-processed foods that just perpetuate this inflammatory response, we can maybe alter our quality of life and our ability to engage in our day-to-day activities. And the relationship is complex. So I'm not going to break down the exact, cellular cycles, because sometimes I'm asked to do that. I'm just going to say that the relationship is there, and that optimizing your diet is a really critical part of what we call whole person care for chronic pain, central sensitivity, chronic fatigue syndrome. And I really don't have any good data because COVID's so new, but I would extrapolate this to long COVID. And then even just from a general health and wellness perspective, the more that you can stay away from these ultra-processed foods and the more we can focus on our unprocessed foods, the better. And so really nutrition-based interventions reduce pain. There's a plethora of data out there that shows that. And when I say there's a plethora of data, these are all the chronic pain syndromes that our studies have looked at that show that switching to a Mediterranean or anti-inflammatory diet can have a positive role in. And I didn't include fibromyalgia because that would light up the whole body, but we also include the fibromyalgia diagnosis, and one that can have a role in nutrition. And so what should you eat instead of those? Again, it's really going back to the basics. It's our fruits and our green leafy vegetables. We really want that to be the crux of half of your plate, if possible. I'm just going to check the Q&A here just to make sure there's nothing, a theme coming out. Okay. Fruits and green leafy vegetables. When we talk about protein content, we want to ideally have fish, lean protein and plant-based protein, so lots of nuts, beans, lentils. Again, by doing that, you're eliminating the pro-inflammatory impact of red meats, but then you're also getting the anti-inflammatory benefits of nuts and the beans and the lentils. So it's kind of like killing two birds with one stone. Please do consume fats, but focus on things like olive oil to cook and flavor your food. You can do avocado oil if you need a higher smoke point. So that always comes up as a question is, well, I'm cooking something at high heat. Can I use a different type of oil? Yes, you can. We just want to limit those saturated and trans fats. And actually, this is one part I think doesn't get enough attention is really drinking alcohol and even wine in moderation. So the recommendations are 1 glass per day for women and 2 glasses a day for men. This is based on the Mediterranean diet. I will say that the content for the alcohol for the Mediterranean diet has often come out of European literature where the wine is less processed and modified than in North America. And so if you've ever gone to Europe and you've had a glass of red wine there and it doesn't give you that sort of horrible next day feeling, part of that comes from the fact that there's less manipulation to the wine out there than there is, unfortunately, than what we get on our shelves here. So that's the recommendation. If you look at actually the cancer guidelines, they're actually recommending like less than 2 drinks a week for men and women. I think it's somewhere in that range. And that's because of the role it can have on our cancer risks. So really, I think just reevaluating the relationship we have with wine, and perhaps we don't always need that glass of wine with dinner. That's a very, of course, a decision that patients have to make on their own. And I don't have strong literature to support that in chronic pain, but I would say there is a signal is there that perhaps North American culture drinks too much alcohol relative to the, you know, the processing of the alcohol we have. But I'm going off on a tangent there a little bit. The key features, the reason why it works so well, if you look at the data, is that when the Mediterranean diet is rich in healthy fats. So we essentially remove the pro-inflammatory fats, the saturated and the trans fats, and instead you're getting your fat content from that olive oil, the nuts, the seeds, and the omega-3 fatty acids. And I'll just remind everyone, I had shown you that table that had looked at the role of supplements in chronic pain. And one of them was omega-3 fatty acids. So those who took an omega-3 fatty acid supplement on a regular basis, just on its own had improvement in their pain scores. So you can imagine if not only do you take a supplement, but you also optimize your omega-3 fatty acid intake from your diet, the impact it can have. You can really get a big impact on the inflammatory mediators by increasing your fiber intake. So daily fruits and vegetables, whole grain breads, beans, peas, and lentils. So these are just some examples of how to get that higher 30 grams per day of fiber. I think the most important part is there's a focus on fresh foods and cooking at home. I think we all know that food that you cook at home tends to be less calorically dense and less rich and less creamy than something you purchase. And the more that you can cook at home, even simple meals, particularly if you have a lot of crashes or if you have a meal delivery program, the more you can control what sort of additives and coloring and trans saturated fats. Sometimes eating smaller portions of high quality foods, particularly if you have mast cell activation or chronic fatigue where even eating is difficult, you don't have to eat a lot, but you can get really nutrient rich foods. And again, just highlighting that drinking that wine in moderation. One of the exercises I like to share is if you imagine your plate as a circle and you cut it in half of your plate should be fruits and vegetables. And the remaining half, you can cut it into another quarter. So 1/4 should be protein and the other protein should be fat. And so if you can just sort of eyeball that, and that really takes the executive sort of focus away from trying to measuring food and all those sort of meal planning things, that's an easy way to try and balance out your macronutrients. So you don't have to measure how much protein you're having in a day, because that can get quite complicated for a lot of folks. I just want to take a minute for the omega-3 fatty acids. The type of fats we have, I think I've said this about 5 times by now, they can be pro-inflammatory or anti-inflammatory. The reason we like omega-3 fatty acids so much is they increase the production of those anti-inflammatory cytokines. So the components of our body that can help fight off that inflammation. And so you can get a lot of omega-3 fatty acids from fish, particularly salmon. I appreciate how expensive fish can be. So the most, I would say, bang from your buck that I've been able to find is probably Costco. So you can get a big fillet, I think for $30, and then you can just cut it up and throw it into the freezer. And then you probably have, like, we counted this, you get 6 to 8 meals from that one kind of piece of salmon. If you go to places like Save On, even Whole Foods, particularly Urban Fare, they tend to be quite pricey. And so if you're on like disability or CPP, it can become unaffordable. So that's sort of how we coach our patients to try and get some of these fish-based omega-3 fatty acids. If anyone has anything better than the Costco pricing, please do share it in the Q&A. We're always looking for ways to make things more financially friendly, especially with food costs. Flaxseed is another great way. Nuts and seeds, you can pick your favorite one. I'll just remind folks, nuts and seeds are quite caloric dense, even though they're nutrient dense as well. So just careful on the handful. I usually recommend 1 handful per day. I apologize, that should not say canola oil. It should just say olive oil. So please ignore the canola oil there. And I'll make the edits before I send this out. If you're going to take fish oil supplements, what you want to look for is that the EPA to DHA ratio is greater than 1.5. And I'll say that right on the back of the nutrition label. It'll give you the ratio. So you're just looking for that magic 1.5 or higher number. And then again, you want to limit your intake of pro-inflammatory fats or those polyunsaturated fats. These are fats they're man-made, they're harder for our body to break down, and those are our sunflower oils and our saturated fats. And so really, if you're cooking with oils, that's fine to do. Just keep it with the olive oil or the substitute avocado oil for the higher smoke points. Okay. So this is sort of our Mediterranean pyramid. And there's certain foods that we want to be having on an everyday basis. So if I go back to that plate that I referenced, foods that we want to have on a daily basis are fruits and our vegetables, and that should be half of your plate. As much as possible, you want that quarter part of your plate to be whole grain breads, pasta, brown rice, couscous, polenta, potatoes are fine as well if you can tolerate them. We want cheese and yogurt. So actually, cheese and yogurt is not a mandatory part of any balanced diet. However, there are some good fats in there. And it is quite tasty and palatable. And I think it's important to note that food is also enjoyable. Like, food is a social experience. It can be a physical experience. There's an emotional experience with it. And so I want people to walk away knowing they can have a really good, emotional connection with food, and their body can feel good, and they can maybe have the odd piece of cheese or yogurt without being so restrictive. So as on a general basis, you want to have, sorry about that. You want to have these type of foods on your plate on a daily basis as much as possible. On a weekly basis, if you can do at least 1 serving of fish and seafood, 1 serving of poultry, and 1 serving of eggs, you're winning. Now, this is the Mediterranean diet, and they put sweets on a weekly basis, meaning you can have it once a week. I will leave that to your discretion and how that makes you feel in terms of your pain and your energy levels. For some people, sweets are really important, and for others, they're not. I say if you have it on a weekly basis, sure, that's fine. If you want to keep it to just a special occasion, that's fine as well. Really caution on the wine in moderation. I think we have a very culture that's become very okay with alcohol consumption, but the literature is taking us away from that. And then on a monthly basis, if you want to have a red meat, that's fine as well. And then of course, you always want to optimize your water and fluid intake, particularly if you have the dizziness or postural intolerance. A healthy lifestyle for your central sensitivity syndromes, for your chronic fatigue, for battling your long COVID, it's not a fad or a trend. And that when we look at the Mediterranean way of eating, and they have in fact researched this, it's actually one of the top 2 healthiest, enjoyable, and sustainable eating patterns. And so it's not supposed to be restricting or punishing or dieting or lifestyle limiting. So if you're finding the way that you're eating is any of these things, just take a step back and see how you can increase the flavor and the taste of our nutrient-rich foods without having so many of those ultra-processed foods. And it might just be, one change a week. So instead of having that Diet Coke every day with lunch, maybe you have it 5 times a week instead of 7. And it's small incremental changes that become sustainable, going from having a really heavy ultra processed diet with red meat, which if that is the way that you eat is fine, because that is what is available on our grocery shelves. Start small. Maybe that piece of red meat will be a piece of fish once a week. And so really it's moderation, it's balance. You want to focus on the portion sizes, and then you want to eventually make it a part of your lifestyle without making it seem so punishing, I think. So we have about 3 minutes before the Q&A, and I see there's a lot of questions in the Q&A. So I think what I'm going to do is, if anyone wants to stay past 6, you can, but I want to spend about 5 minutes just going through the resources, and then we will go into the Q&A. Okay, so I'm just going to pause my screen share here for a minute and just open up my web browser. Okay, so can everyone see my web browser here with the Cookspiration website? Yes, okay. So I like this website, cookspiration.com, because it's put together by Canadian dietitians. So it reflects the foods we have on our grocery shelves. It reflects the reality of food prices, and it's reflective of a lot of the cultural practices that come along with eating in our country. Because I will say we are not the United States. We don't have massive portions, and we don't supersize everything. So I know I said 58% of America's caloric content is ultra processed. It's probably a little bit lower here in Canada, but I don't have those studies. So the reason I like this website is because it takes the executive functioning and the thought process behind making good food decisions. So this link will be in the presentation, and the way that I like to use it is by clicking on the menu planner, and I'm going to skip the tutorial, and I'm going to go with what a lot of my patients tell me they have, which is gluten-free, not because they have celiac, because they're gluten intolerant. And so we're going to go gluten-free, and then food prices are insane. So I'm going to say budget-friendly too. And so if those are your priorities, we'll start with that. You can review your meal plan. Yep. Just give it a minute to load here. And of course, the the website chooses not to work on the night of our presentation. So let me just try and switch over to a different browser here. Okay, just stop my screen sharing there for a moment. I am very sorry to all 284 of you who are here. I was really looking forward to sharing this resource with you, but I'll just show you my screen. The website was working great this afternoon when I tested it. Oh, here we go. Okay, here we go. I didn't leave you all disappointed. Can everyone see the screen there? Okay, great. So we chose a budget-friendly, gluten-free approach. And I think it's still loading a little bit slow here, but you sort of get the general gist. These are dietitian approved, cost-friendly ways to eat. And so there are breakfast and other dinner options, they're just not showing up here. But they will give you, for instance, a terrific tuna and tomato salad. And when you click on it, it'll tell you how long it takes to make. So 5 minutes if you're in the midst of a crash or you've sort of used all your spoons for the day. Hopefully this is something that is within your capacity. And it'll give you the ingredients. It'll give you the instructions, and it'll give you your nutritional value. And I'm just going to hone in on the things that we talked about, which is our saturated and our trans fats, focusing on our carbohydrates and our protein intake. So you can see it's rich in protein. You still have good carbs and you still have some good fats as well, none of which are saturated or trans fats. And so the ingredients are things that are not overly complicated or expensive at a grocery store. And they often include a few tips as well. And what I tell folks who really want to kind of conserve their energy and stay within their energy capacity is you can simply double or triple this and have it for lunch and dinner for a day or two in a row. And then do the same thing if you go back here. So take the time and play with this, see if it works for you and your family. There's also the option for kid-friendly recipes because I know food is more than just an individual, it's the families. I know my son doesn't eat anything I make, no matter how hard I try. So you can maybe go through this with your partner and you can maybe pick out for the week what you're interested in eating. You can, I think there's an option to have your grocery list actually as well. So I think if you pick your foods, step 3 is they'll give you a shopping list, and then step 4, you can download and print your grocery list and your recipes. So for me, this is probably one of the better resources to help take all of the sort of the stress out of figuring out what to eat in a day. I do have 2 more resources. I'm going to save those for maybe you all to explore on your own, just for the sake of time, because there's so many questions. And then I'll also say part 2 of this presentation is actually going to be mostly a Q&A session because from my experience, people have so many questions, we can never really get to all of them. So if I don't get to your question, know that we will save them all. You can also email them to me. I will put my, I will get Bruno to actually send out my email address. And then that way, when we meet for the next part 2 session, I can also answer your questions there because sometimes I need to look up some data and sometimes we just don't have time. So I hope that was helpful and informative. I know for some of you it might have been really basic and you've already heard all this information before. And for some of you this might seem like a completely different way of consuming and enjoying food. So wherever you are in that trajectory, I hope you took something away from it. And so I'm just going to take a moment here and try and find where we start with the questions. And Bruno, if you're still online.
Yes, I am. I'm listening.
Yeah. I am correct in that the Q&As will be saved, correct? All the questions that our attendees ask?
No, they They can send me the questions and I can put them on a list and get back to you if you like. Usually the Q&As are not saved, so they
Oh,
will.
they're not saved. Okay. Okay. Sorry, folks, I take that back. So if we don't get to your question, you can either email it to Bruno or you can email it to me and we'll answer it next time around. Okay. So lots of questions about the slides. Okay. And volume and microphone. Lots of comments of volume and sound. I'll keep scrolling until I get to your questions. Okay. Okay, so I think the first question was actually from Shawani. It just sort of asked about my background, so I did answer that one. Alpha lipoic acid versus NAC for ME/CFS, and that's a great question. So there is some very limited data on NAC, nothing robust, nothing concrete. The comparative that I can share with you in terms of supplements is PEA. So PEA, we have some really good data and clinical experience with as a supplement. I actually specifically tell patients I don't have that same type of data for NAC, and I have even less data for the alpha lipoic acid as a specific supplement. So my answer to that is neither from an evidence-based perspective. However, you are absolutely welcome to try either if it's within your budget, but I can't make a definite recommendation for that. Krista, actually, I'll try not to say the names here for privacy. Can you give tips that work for people with low energy and rely on food banks? Great question. Yes. In terms of the cheapest grocery store, it's actually No Frills. So if you're in the Lower Mainland, there's usually a neighborhood No Frills. Their produce is probably the cheapest, and their basics are probably the most affordable. I encourage people to, if it's within their energy capacity, if you're buying meat-based or animal proteins, to buy them in larger portions and then to freeze them, because you can actually get more bang for your buck by buying a larger portion. And then you still save the nutritional content if you freeze it. And then the same thing goes for actually berries and veggies. So you don't lose any nutritional content by having frozen berries in your smoothies or defrosting the strawberries. You can even get chopped onions that are frozen, so you don't have to spend the time chopping those things. You can get chopped butternut squash. All of those are available at No Frills. And so really finding ways that you can cut the amount of time it takes to chop and prepare. Going to grocery stores where the focus isn't on the presentation of the grocery store, but just the core fact that food is available. And then also using just these really simple resources like Cookspiration, where perhaps you, at the end of your workday, you have too much brain fog and you can barely get out of bed. Well, you can throw together canned tuna and some chopped tomatoes and a little bit of salad, and you have a great nutrient dense meal. So I hope that's helpful in just a few different strategies. I know everyone's situation is so unique, but if there's one takeaway I've learned from my patients, it's that meal prepping when you have the capacity and freezing things, and then not being afraid of buying frozen products that aren't processed. Someone asked, have you seen the limited series, You Are What You Eat? If so, any comments? I have not seen it, but I can add that to my watch list. Next question is a question about MCAS. I'm going to leave the MCAS questions to next time, simply because it's an entirely other topic, and I could probably talk about half an hour to the things that we know are helpful and not helpful with MCS. So I'm just going to put those on the back burner. And that was also the next question. Someone asked for a resource to share with friends and loved ones, you're welcome to share this presentation with them. And I know Dr. Arsenault also puts on a friends and family event that your loved ones can definitely join in on. And certainly it is a very isolating experience. Someone asked, what if we suspect the lack of absorption of the nutrients? How do we know we are actually absorbing food nutrients? Personally, I feel like I am not. Yeah, so gut dysfunction is very real. One of the things that I don't have a specific lab test that you can go and do and measure you know, the capacity of your colon and your small intestine to absorb nutrients and your body's ability to take that and use it to produce glycolysis. But what I can say is there are things that you can do to improve the gut microbiome, certainly. A number of those are actually our fermented foods. So things like kefir, fermented yogurt, you can actually make at home. My background is South Asian, and I know that we grew up eating homemade fermented yogurt. And it is actually, it takes about 5 minutes to make. And so I can share that recipe for those who are interested in the second part. So fermented foods, things like sauerkraut. Actually, some people do fermented veggies. Those can optimize your gut microbiome. You can also take, I think it's 5:45, so maybe my brain is slowing down a little bit. You can take probiotics to also support your gut microbiome as well. And so there are a number of things that we can do to kind of shift and change our gut microbiome. This is a tough one, especially if you have chronic fatigue syndrome, but we find that there is a very direct gut and brain connection. And actually improving our serotonin and dopamine levels and creating more of a balance through exercise actually has some benefit to it. I know that's really challenging if you have such little capacity, but then there's also other things that improve our serotonin and dopamine levels that I'd extrapolate to like parasympathetic nervous system work. And so it is really all connected. Someone asked, how do you measure how much adipose tissue you have? You can actually get that tested at like a local gym. They often have a machine that you can go in and you can sort of see your body composition content. We are focusing a little bit more on waist and abdomen circumference, but really it's, if you really want that measure, it would be a body composition test, which I think if you just put into Google and search for your local city, you'll find a lot of different options on. Someone said, is it okay to take magnesium daily for constipation, or is there something else that is better? Magnesium is great for constipation. I actually, when patients come in with inflammatory or irritable bowel disease and they tend to be constipated and they have fibromyalgia, one of the first things we tell them is to take magnesium from 250 to 500 milligrams as a starting point. And then we say titrate to your bowels. So you can take it up to 1 gram a day. Usually most people tend to get diarrhea around the 750 milligram mark. So yes, you definitely can take magnesium for constipation. You can also do things like fiber to help build bulk and increasing your water intake as well. Again, that 2 liters per day is that sweet mark, but no issues with the magnesium citrate. Someone said, how does LDN affect the gut microbiome? I should clarify, it doesn't specifically affect the microbiome in the ways that we know antibiotics do, but polypharmacy, meaning taking multiple medications for long periods of time, certainly can. This question is, how are you testing for, I'm going to say, I don't know. I'm wondering if that's a spelling error. So perhaps I'll just get you to resubmit that question. And then Angela made a bit of a comment that I'm going to take a second to read here. Great. Thanks for your comment there, Angela. Someone asked about stimulants and stabilizing leptin hormone. I've heard a bit of a murmur about the stimulant medications and leptin as well. I don't know if there is, I don't know if the protocols at the kind of the gold standard obesity clinics are using it. So that is something I can get back to you on, but I have heard some murmuring about that being used. I think I answered this question, the intermittent fasting with chronic pain, for or against. I generally say if I can't tell you that it's going to be beneficial, I won't recommend it. There are certain things that really don't have any harm. So I say if you want to try it, go ahead. I do think there is some harm to any type of really big modification of when you eat and what time you eat. So for that reason, I don't recommend people just go ahead and try intermittent fasting. I think if it works for your lifestyle and it's not triggering, please go. You know, you're welcome to try it, but it wouldn't be my first line recommendation for chronic pain. Someone asked for a private consult appointment. I don't have my own private practice with Dr. Arsenault. I did speak to him about potentially joining him on a little bit more of a regular basis. So if that's the case, certainly he will send out an email because I think there's certainly such a need to help our population here. Oh, someone gave me the tough question. The non-restorative sleep. You sleep too much, yet you don't wake up feeling refreshed and you're still fatigued. Any suggestions on diet? That's a tough one for me to answer without knowing your history and your diet composition. What I will say on an overarching level is non-restorative sleep, where you wake up feeling unrefreshed despite sleeping all night, is part of the problem in chronic fatigue syndrome. So as we modify our diet to be sort of overarchingly more anti-inflammatory, less pro-inflammatory, and we work on pacing and activating the parasympathetic nervous system, all of those things will help the sleep. So it is a little bit tough to just optimize your diet to augment the sleep. It's all of the pieces that come together. So it's a great question about feeling full despite minimally eating. I'm going to leave that question to next week so I can just give a little bit of more of a nuanced answer. I'm sorry, Chloe, I'm not going to, I don't think I can answer that fully just in our remaining time. Someone asked about Ozempic. Ozempic, it can be a really great drug for diabetes and folks who have had challenges losing weight. I went to a great chronic pain talk, and there was someone who stood up and said, Ozempic is going to change the world. And they're actually, almost every single physician said, no, we don't agree with that stance. The reason for that is Ozempic is just one piece of the puzzle when it comes to weight and body composition. There are so many other things that we can do to change our body composition. And this was just the overarching feeling in the room, is that, you know, it's also things about movement therapy. So movement is restorative to our mental health, our physical health. There's your cardiovascular status, your bone health, osteoporosis, falls risk, our cognitive status. So I don't think Ozempic is the gold mine that maybe it's being touted for. Certainly it's an excellent tool to do in addition to all the other things that we know are really good for us. But I think just using it alone, I wouldn't recommend it like that. I think if you've been recommended it by your physician to take it for either diabetes or chronic weight gain, then certainly go ahead. I'm not opposed to it at all. And certainly there's a role for it. Someone made a comment on how they tried the whole food diet and they didn't notice any difference in their pain. It actually made it harder for them to stay on it because you didn't feel any better. I have actually heard that like a few times where they feel like they've changed their diet, they've put in all of this effort, and they're not noticing any changes. And certainly, I think like any medication or any pain procedure or even infusion therapy, ketamine therapy, we're always going to see a subset of folks who don't respond to the intervention. I'm sorry for the folks where they had such high hopes that their pain would improve, but I would say I would tell the person to stop doing the procedural pain management if it doesn't make a difference, but I wouldn't tell the patient to go back to their unoptimized food intake, because there's so many other ways that optimizing your nutritional intake can impact your body. We know it helps prevent cardiovascular disease, type 2 diabetes, Alzheimer's. So if you're able to maintain it for those other lifestyle features and the other health benefits, awesome. If you're finding that it's just too exhausting and it's making your pain and your fatigue worse, maybe pick a few components that you are able to incorporate and just know there's other downstream health effects that you can have. Teresa said, are these dietary changes also with chronic fatigue? Do they? Yes, certainly they do. And in fact, our dietitian at the Complex Chronic Disease Program follows all of these principles. Our data with the chronic fatigue syndrome isn't as robust, but certainly we see the virtually identical signals as we do in chronic pain. So yes, definitely extrapolate to the chronic fatigue world as well. How are we doing for time here? What advice do you have for nutrition for brain health and vestibular health? Okay. So I think the question is related to dizziness, and actually you said central dizziness. I don't know if you are specifically referring to like vestibular, because that's a different process than the dysautonomia. But if you're not, and it's the postural dizziness, certainly making sure that you don't have coexisting POTS. So POTS is postural orthostatic tachycardia syndrome. You can diagnose that with your heart rate and your blood pressure. Usually we have folks see cardiology, or at least someone who specializes in the area. And we're looking for very specific changes in your heart rate and certain numbers with your blood pressure as well. In those cases, we usually recommend at least 2 liters of water per day and a 1/4 teaspoon of salt 4 times a day. I would say the salt and the water would be relevant for anyone with orthostatic intolerance. So even if you don't have POTS, but you have the dysautonomia that comes with chronic fatigue syndrome, just making sure that your blood vessels are full, and we say plump, so there's lots of blood circulating, blood volume can be quite helpful too. Oh, someone asked me about the early stages of kidney disease in the nutrition protocol. So there's actually a very specific chronic kidney disease diet that I know exists, but I don't know the nuances of. So I would defer to my colleagues in the chronic kidney disease clinics to maybe help you out there. Someone asked about vitamin D. Yes, 1,000 international units per day. Everybody should take that amount of vitamin D. If you can go up to 2,000 international units, I would not recommend those really high dose vitamin D protocols. There's no evidence behind it. So some folks are taking 5 or even 10,000 units per day. If anything, it can interfere with the absorption of other vitamins. But 1,000 to 2,000 international units, especially within the gray sort of climate we have here in North America and Vancouver, and just BC as a whole, it's important. And there is some data that optimizing this vitamin D level can improve some of the chronic fatigue as well. Diana said, what vegan supplement do you recommend to treat chronic fatigue? So Dr. Arsenault and I are on the same page on this. The one supplement we recommend to almost anybody with chronic fatigue is PEA. So that's 400 milligrams 3 times a day in divided doses. I know there's a group specifically on the supplements. And the reason we recommend this is that we have some evidence that it works. And it works a little bit similar to the low-dose naltrexone. And also there aren't any medication interactions or side effects. So if you're really medication sensitive and you get a lot of side effects, even at those small doses, PEA is a great place to start. I don't know if it's vegan. However, I'm sure the nutraceutical store could let you know if it is. Someone asked about brands of omega-3 and multivitamins. That's a tough question to ask because, again, some of it is marketing. There's also no regulation in the supplement world. So you can just put a supplement out there on the market, and you don't have to test it or prove anything. In general, I find the AOR brand is quite, I mean, it's good. I have some AOR brand supplements in my cabinet, if that means anything. But I also have some of the Jameson brand supplements. So I think if you were to go with either one of those two options, those are fine. I would say think less about the brand and more about the amount of the supplement that you're taking and which supplements. I think there's questions related to the histamine intolerance and MCAS. I will get to that question next time. And I think you're the same person who asked the MCAS question to the last one I skipped over. So I apologize for skipping over two of your questions. Interesting question about the duloxetine and the omega-3s. You know what? I am not familiar with that recommendation. I will have to get back to you on that. I don't think at the standard doses of omega-3s, there's any reason you can't take duloxetine and omega-3s. We certainly don't do it at the BC Women's program, but I will look into it and get back to you on that. Is there any way to improve your microbiome permanently? So that's a wonderful question. So like anything in our body, our microbiome is in a fluid state. And there are going to be fluctuations in it. And so I would say if you already have gut dysfunction or you have challenges with your microbiome, it can often be something that waxes and wanes and is lifelong. So we, of course, don't diagnose microbiome dysfunction as a chronic illness, but certainly just like chronic illnesses where it's a lifelong endeavor, and something that sometimes you need active management, and other times you can be a little bit more passive on it. That's what we find with gut dysfunction as well. And again, it's not just the foods that we eat, but the way that we breathe and the way that you sort of engage in your environment, and the types of foods that you eat as well. So I would say, no, I don't have a specific recommendation to say you can flip a switch and fix your microbiome on a permanent basis. It's definitely something that needs quite a bit of work for long periods of time, like pain and pacing. Someone asked about animal product. No, they asked about dairy foods and inflammation. So we think that the pro-inflammatory impact comes from the protein lactose. So if you filter out the lactose, some people are able to tolerate these dairy products a little bit more. Because the lactose is the protein that we think people develop the intolerance to. So for instance, when babies are breastfed and the baby is lactose intolerant and they develop, they have diarrhea and they become upset every time they breastfeed, we put mothers on a lactose-free diet. And that allows them to continue to breastfeed. So sort of the same understanding is with the dairy products and the intolerances, and that it's a lot of the lactose that perpetuates the inflammation. So no, from our understanding, not all dairy causes inflammation. If you switch over to like a lactose-free Greek yogurt, which you can get at No Frills, they're not confined to just these specialty stores anymore. You might be able to tolerate that a little bit better. I'll do one last question, and then we'll hit the 6 o'clock mark. And I'm sorry, I see there's so many questions that I didn't get to, but I will certainly get to them next week. And if you could email them to Bruno or myself if I didn't get to them, please do. I'm going to just do this last question about I think it was about weight issues and their infection or conditions started. So I've tried vegan diets where healthy people have quickly lost weight, yet I did not. Are there any studies that have confirmed a specific diet for those who started dealing with weight issues after their illness started? So in the context of patients who gain weight after a diagnosis of ME or CFS or fibromyalgia, is there a diet I can recommend? No, I don't have that very nuanced data yet. Certainly, we have made a lot of breakthroughs in our obesity research that has shown that, again, weight isn't just calories in and calories out. For a lot of people, once there is a certain threshold of adipose tissue that's been hit, it becomes a neuroendocrine, neuroinflammatory process. So the hormones have changed, and that's where Ozempic becomes helpful. That's where targeting the leptin hormones becomes helpful. And so it's actually a multi-system issue rather than just changing the foods that you eat. But remember, and I've sort of said this before, you can still follow the Mediterranean diet. And even if that number on the scale doesn't change at all, just know that you're also doing a lot of other really great things for your body by optimizing and switching to that anti-inflammatory diet. So unfortunately, if you're finding it's becoming to that case and you simply cannot lose the weight, it might be time to see a specialist when it comes to weight. And I think it's wonderful we finally have specialists who deal with this. I will pause it there because it's 6:02 and I'm mindful of Bruno's time too.
Don't worry about me. But yeah, we will see you in a few, I think it's next week or after that. I don't know the dates, but thank you for your time, Dr. Inderveer Mahal. And I'm sorry, Dr. Arsenault was sick today.
No problem. And I hope everybody found that helpful. And Bruno, if you can maybe just not end the meeting so that I can maybe try and find a way to save some of these questions so we don't lose some of them, that would be great. And again, I wanted to thank you all for taking the time out of your